Hello friends, today we are going to discuss about COVID panic. I'm Dr. Suresh Padadmat, Professor of Psychiatry, working at NIMHANS, Bangalore. We all heard about COVID pandemic, but COVID panic is creating more problem than the pandemic itself. What is this panic? Panic is sudden, uncontrollable fear or anxiety, often causing irrational behavior. Here, the point to be noted is often causing irrational behavior. So, because of this irrational behavior, what is the impact on the individual, on the family, on the society as a community? We will discuss that now. Let's discuss about the COVID panic. What is the irrational behavior which is going to trigger, and also what is the impact? At the individual level, it causes stress. Of course, stress for a short duration is good, but in a situation like a pandemic, which lasts for 1 to 2 or 3 years, this stress can be damaging. Because of the stress, the immunity decreases. If the immunity decreases, you will become susceptible to COVID. Because of this panic, anxiety will increase, and also anxiety disorder. And because of constant anxiety and panic, depression, suicidal thoughts, and also death by suicide is becoming common nowadays. At the same time, to do self-treatment because of this panic or anxiety or fear, people have started using alcohol more, tobacco, and other drugs, which is unwanted, unwarranted. At the same time, the pre-existing diseases like diabetes, hypertension, mental illness, psoriasis, many other disorders, they become very difficult to control or they will worsen. At the same time, a pre-existing disorder which was cured can relapse now. Hence, my dear friend, you have to be very careful not to become panic because of COVID. Let's understand what is the effect of this COVID panic on our family. Because of this COVID panic, if the family leader or the father or the mother becomes highly panic, the family functioning becomes very poor, family fights will be more, the anxiety will be transmitted to the children from the parents, which is unwanted and unwarranted at this point of time. Elders are neglected. We have seen very often, because of the COVID panic, the children will not take care of their elderly parents. This is very sad. This is just because of panic, and this COVID panic is triggering stigma in the society. And we are many a time discriminating our own family members, which is unwanted at this point of time. And at the same time, help-seeking behavior is changing because of COVID panic. There are either many people who are very anxious, may do excessive consultation with the doctor, they visit the hospital very often. At the same time, many people, because of extreme anxiety, they don't go to the hospital and they delay the consultation. And because of the low oxygen saturation, the doctors find it very difficult to treat them. Let's understand the importance of this COVID panic at the family level. Please remember, the generals don't panic during the war, basically the military leaders. If they don't panic, the troop also never panic and they will win the battle. Similarly here, the parents should not panic. At the level of community, this is a very essential point. Please do remember, at the community level, if the panic gets transmitted, it will drive the market into volatility, which is unwanted. The Sensex becomes very, very volatile. At the same time, the hoarding of the essential material occurs. The people who have money will start buying these essential materials and they will start hoarding and they will do unethical businesses. Antisocial elements will keep oxygen cylinders, remdesivir medicine, requirement of ambulance will be, the hiring of ambulance becomes very difficult. And this sociopaths or psychopaths will use this opportunity to make money, and they will be waiting for this panic, and they make money when there is blood on the street. This is unfortunate. So I request you kindly not to panic. We know scarcity of resources can be triggered by panic. Panic is irrational behavior. Irrational behavior can cause irrational buying, irrational distribution of resources, and also irrational use of resources, which is unwanted, unwarranted during this pandemic. So we need to know how to manage our panic. First and the foremost, know the facts from the reliable sources. That means 90% it is a mild disease, and remaining 8% it is moderate disease, and severe disease is only 2%, mortality is 1%. Compared to other epidemic like Ebola virus epidemic or else Nipah virus epidemic, which is the mortality is 50%. Here it is hardly 1%. So no need to be panic, and we need to behave rationally. Have vaccination, plan for eventuality. That means your family may get infected with COVID. What is the plan? Who will take care of them? Which doctor will be contacted? Where is the nearest hospital? All those need to be discussed. At the same time, regularize your routine day. Have a regular sleep habits. Avoid panic generating foods like tea, coffee, and various other stimulants. Please avoid that. Stop alcohol, tobacco, and other drugs which you want to use to decrease your anxiety. Limit your exposure to media, especially televisions who sensationalize the COVID panic. So please do not watch them and limit it. Please do yoga, meditation, and prayer. They play a very important role during this COVID pandemic. At the same time, talk to your children. More than talking, listen to them. Validate their emotion. If you are feeling anxious, tell them yes, it is normal to feel anxious during this pandemic. Give them the facts. If you don't know the answer, tell them I will read in the internet from a reliable source and explain them. Encourage for hobbies, have indoor games, connect with your friends and family on virtual. Help others, support others. With that, you get a meaning in life. Take very often breaks. Have hope. Transmit hope, not panic. Educate other about this panic and also this video. To conclude, my dear friends, this COVID is going to infect everyone, but at the same time, predict, prepare, plan for adversity. Discuss with your family members. Please do seek help from the professionals if required. Use telemedicine very often. Please do remember this fear. Fear is nothing but false evidence which appears real. So please keep your facts proper. Thank you very much for giving your valuable time. Stay safe.